Okay. So next part is a quite common topic, whether for medical school or generally the higher exams like MRCS or any different exam. So you need to know the boundaries of the triangles of the neck and sometimes the content of these triangles as well. So triangles are generally classified into anterior and posterior triangle. And the main, if this is the muscular process, and if this is the clavicle and attached to the, obviously the uh, sternum, okay? So you have a muscle in here coming all the way down, which is called the sternocleidomastoid muscle. So anterior to it is the anterior triangle, and posterior to it is the posterior triangle, okay? So moving forward, so again, yeah, this is the sternocleidomastoid muscle, starting from this one, sternocleidomastoid muscle, and obviously it's coming from the outer surface of the mastoid process, and they're inserted by two heads. You have a sternal head and the clavicular head in here. Okay, sternal head and clavicular head. There is a small space between them, as you can see down there. Okay, so anterior to it is the anterior triangle, and posterior to it is the posterior triangle. So what about the boundaries? So let's talk first about the anterior triangle. You have anteriorly, it's the midline, just an imaginary line in the midline, and superiorly you have the mandible all the way up. Okay, sorry, and the posteriorly you have the anterior border of the sternocleidomastoid muscle. So this is the anterior triangle of the neck. However, this triangle is divided into 4 subtriangles, starting from this important muscle, digastric muscle. So right there. So this is the digastric muscle, anterior and posterior belly of the digastric muscle, right there. So it will divide it into triangle above it and triangles below it as well. However, there is another muscle as well, which is a very important muscle as well, called omohyoid. It's a critical muscle. So you have part from here, that's the superior belly of omohyoid muscle, and another part there, the inferior belly of omohyoid muscle. Okay, so let's look at how many triangles do we have now. So you will have a triangle in here. So this is, it's just below the mandible, so it's called submandibular triangle. You have a triangle in here, which contains lots of muscles. We call it muscular triangle. You have another triangle in here, which mainly contain the carotids. We call it the carotid triangle. And another one, a very small in here, is called subtriangle. It's called submental triangle as well. Okay, so 4 subtriangles in the anterior triangle, and you know it's divided by the anterior and posterior belly of digastric muscle and the superior belly of omohyoid muscle. Okay, so now we can say the boundaries of each of these triangles. The subdivisions of the anterior triangle as well. And also, you can, if you look at the posterior triangle, you can see that this is the inferior belly of omohyoid muscle dividing into 2 triangles, which is, this is the occipital triangle, just above it, and below it is the clavicular triangle. All right. So, okay. So starting by the borders of the anterior triangle, like we said, midline and anteriorly, and sternocleidomastoid posteriorly, and the mandible superiorly. The subtriangles, we mentioned the submandibular triangle, and we can name the boundaries for the submandibular triangle. You have the anterior belly of digastric and posterior belly of digastric, and also the mandible superiorly as well. So you have the mandible, the anterior belly, and the posterior belly, just like that. So, and it contains mainly the submandibular salivary gland and some submandibular lymph nodes as well. The facial vessels, artery and vein, which will be just anterior. If you have this, the masseter muscle, you will have the vein and the artery just anterior to it. You'll have a nice diagram that will be shown in a bit, and also the hypoglossal nerve. So you have the submandibular gland, which is deep and superficial part, and you have the hypoglossal nerve, which is found in between the deep and superficial part, in addition to the facial vessels, so facial artery and facial vein as well, and some lymph nodes just present all the way around. So these are the contents of the submandibular triangle. Okay, so looking at this one as well, so it's even further division. So you have here, this is the mylohyoid muscle, digastric muscle, and the posterior belly of digastric muscle will be right there. I think this is from Teach Me Anatomy. You will have here that's a triangle containing submandibular salivary gland, submandibular lymph nodes, and so on. That's a submental triangle. The boundaries for it is anteriorly the midline, and posteriorly anterior belly of digastric muscle. Inferiorly is the hyoid bone, and it contains mainly the floor formed by the mylohyoid muscle. You have the carotid triangle. The carotid triangle boundaries will be again is and if you go back to that nice diagram, so this is the carotid triangle. Anteriorly is this muscle, which is the superior piriform hyoid muscle, posteriorly cleidocmastoid muscle, and superiorly part of the hyoid bone, and the posterior digastric muscle as well. And it contains the carotid sheath containing the internal carotid artery and part of the common carotid artery, and the vagus nerve as well will be there. Okay. In terms of the last triangle, which is the muscular triangle, remember the boundaries is hyoid bone superiorly, midline anteriorly, and also lateral on both sides. You have the superior piliform hyoid muscle, and the inferior is the sternocleidomastoid. If you go back again, so that's the muscular triangle. You have this one and this one. So sternocleidomastoid and superior piliform hyoid and midline anteriorly, and the hyoid bone in this area. It's not actually a triangle. It's sort of coming in the way like that. All right, if that makes sense. So it's not really a triangle, and it contains all the suprahyoid, the infrahyoid muscles, and we will explain them in a bit. Okay, so it contains the strap muscles or infrahyoid muscle. These are the infrahyoid muscle. You have they come from the sternum, so you have a sternohyoid, sternothyroid, and thyrohyoid muscle as well. Okay, so this is the muscular triangle, and like I said, it doesn't look like a triangle. It's sort of that shape. Okay, great. Finally, the posterior triangle. This is a very nice diagram as well from Teach Me Anatomy. So you have here this is the boundaries, posterior border of the sternocleidomastoid, and part of the clavicle, middle third of the clavicle, and also the anterior border of the trapezius muscle posteriorly, and it contains the inferior biliform hyoid muscle divided into two further triangle. So that's one, and that is two. So I mentioned the boundaries, sternocleidomastoid, trapezius muscle, middle third of the clavicle, and the apex is mating of the sternocleidomastoid and trapezius muscle. It contains the anterior, middle, and posterior scalenus muscle, and levator scapula, and scapetus is splenius capitis as well. So it's all these muscles. So you have your splenius capitis and scalenus anterior, scalenus medius, and the scalenus posterior, and also another muscle, which is the levator scapula, which will be this yellow bit. Okay. Divided, like we said, inferior biliform hyoid muscle into occipital and subclavian triangle, or the clavicular triangle. Contains some nerves, accessory nerve, phrenic nerve, brachial plexus, cervical plexus, vessels, external jugular vein, and subclavian artery, and muscles, like we said, all the muscles, and lymph nodes, supraclavicular lymph node, and occipital lymph nodes. These are the contents. All right. So we're gonna come to explaining all the. So you have here the spinal accessory nerve. You have your greater auricular nerve as well, and it contains the brachial plexus between the middle and anterior scalenus muscles, and also the phrenic nerve, which comes from the part of the brachial plexus C4, 5, and 6, and vessels like say jugular vein and subclavian vein.